So today we're talking about part two of understanding employment rights and responsibilities, or responsibilities and rights. We're talking about learning outcome three, which is know how your own role fits within the wider context of the sector. So I've got a few questions on this topic then. First one is describe the effects of your role on service provision. So you want to think about how your role fits into service provision directly, how do you contribute to the service, and why is your role important? So let's say you're a non-emergency patient transport operative. In that case, you would want to think about what you do, how you work with others, how do you work with your management, how do you work with the service control. In other sectors, you might think about, let's say if you were in a care home, you'd be thinking about how your role fits with, well, let's say you were a care assistant in a care home, you'd be thinking about how your role fits with management, with the team leads. What exactly are you doing and what are you contributing? So again, if you're non-emergency patient transport, you are providing a transport service to patients on their way to and from inpatient services, inpatient stays. You are providing transport to and from, let's say, the dialysis clinic, and you're providing a safe environment for your service users. You are also hopefully providing a comforting presence in what might be a difficult time for them. So next we've got describe how your role links with the wider sector. This one might have some crossover with the previous question, but in this one, ignore the spelling mistake again, there's a spacing error in there. So how does your role impact on the wider sector? What would go wrong if you weren't there to do your role? And what are the effects of good and bad practice is important here as well. So again, if you're patient transfer, you are making sure everybody gets to their appointments on time. And then talk about the impact of that, and if you weren't doing that, what would happen? Would there be a negative impact in that case? And you can talk about the positive impact of trying to make sure everyone's there on time, or at least if there are going to be delays, updating control and updating people so they know what to expect. You can also talk about the impact on the service users. You can talk about the links that you develop with staff in different settings. Like if you're often visiting particular care homes or particular hospitals, then you might develop links with them, you might share information, and that might lead to improvement in the service. Okay, next one, we have described the main roles and responsibilities of representative bodies that influence the wider sector. Now, employee representative bodies include Unite and GMB, they're unions, so their roles and responsibilities would include being present or representing people depending on the circumstances in, let's say, grievance procedures. They'd also represent the wider group of employees in any negotiations, say on pay or hours or any changes like that. You have the Department of Health. They represent the government and the people. and their roles would include monitoring services and managing finance and creating policies. ACAS is again more to do with employee representation, but they do, if there's a dispute between the employee and the employer, let's say if we thought there was a dismissal, if there might have been discrimination, then ACAS often are the people to talk to. The health and safety executive, their role is in enforcing health and safety rules and regulations and making sure that hopefully making sure that workplaces are safe. And then the Care Quality Commission, their role involves inspecting health and social care providers, so including hospitals, care homes, anything else related. Their role is involved in inspecting and making sure the standards are high and safe. Okay, so your next job is to outline different viewpoints. So it has to be viewpoints plural, and outline does mean to give the main points. So we can't just state what the issue is. We can't just state the issue of public concern. We have to give a few points on what we think different groups or different people might think about it. So outline different viewpoints around an issue of public concern relevant to the sector or occupation. So a couple of things that are relevant in the health and social care sector. A&E closures might be one, removal of student nursing bursaries could be another, location of substance abuse treatment facilities, anything that you can think of that would be an issue of public concern. So for that, you might think about what the public thinks or different groups in the public, because you can often have different thoughts on this, and maybe what the hospitals thought or the government put forward as their reason for a change. That would be important. Like if we had a look at the location of substance abuse treatment facilities, we might think about oftentimes the public object to these being in their area. However, there is definitely a need for these. Professionals say there's a need for it. Groups that represent people that have had these difficulties would say that there's a need for it, and the evidence bears out that it does seem to be for the best. But local groups tend to object to them being in their area. So you could make a few points about those. If you can find an example, if you look online and find an example in the newspapers, it's often reported when local groups object to facilities in the area. You could also find examples of probably protests of A&E closures. So the trusts will often say that they are consolidating services into one area to try and give a better service for a lower cost, but local groups don't want their local A&E to close because they'll have further travel if there's an emergency. So have a look, see what you can find about those or anything similar. Right, describe how issues of public concern have altered public views of the sector or occupation. I didn't mention on the last page safeguarding issues. They also come into issues of public concern. So any of these, they might affect the trust that people have in the service, especially safeguarding issues. After, let's say, the Winterbourne report came out on a care home where there was abuse going on. After that came out, people were saying that they trusted care homes less. So that might be an issue that you could talk about. There's also confidence in the service. So with the A&E closures, maybe people don't feel confident that if there's an emergency, that they will get the service and the care that they need in a timely manner. And it might again, with the care home reports, it seems to affect how likely people think they are to use the service. So there are issues like that you could talk about. All right, next one. Learning outcome 4 is know career pathways within your own and related sector. So knowing about the opportunities available to you. So we want to talk about describing occupational opportunities within own and related sectors. It does say describe, so that does mean that we want to say a bit more about it. It wouldn't just do to say the role that you are interested in. You'd have to tell us a bit about what's involved in that role. So we want to talk about possible opportunities. It does say, oh, spelling mistake again. It does say opportunities plural. So do make sure to put down more than one. You want a minimum of 3, absolute minimum of 3 for this. More would be better if you could. 3 to 5, let's say. And don't just think about your own sector. So you want to think about within your own organization, your own current setting, what could you do and what's involved in the role. And then if you went a bit broader within the broader health and social care sector, what could you possibly do there? So make sure you're describing and make sure it is opportunities plural. Okay, our next one, identify sources of information relating to a chosen pathway. So now, maybe from the pathways you picked before, tell us a little bit about that. So pick one and say who you could ask about it. Let's say if it was within your own organization, you might ask your manager for information. You might talk to colleagues, somebody in the role currently. What did they do to get there? What do they think you should do? Would they do anything differently? You could have a look at websites like the NHS jobs website to see job descriptions for similar roles to what you're interested in and what you would need to have your CV match up to that role. You could have a look at, depending on what you want to go for, college or university websites, again, to see what you need for the entry requirements to these courses and what would be involved in that path. Open days, like college or university open days, sometimes bigger companies have open days too, or they have job fairs that might be useful to go to, and you could talk to people in that sector or maybe those roles. And if you could arrange any work experience or shadow shifts. I do apologize for the spelling mistakes. I have broken my hand, so I am typing badly one-handed and it does take a while. So I will re-upload this at some stage when I've corrected everything. But at the moment, I have a broken hand. Okay, so can you arrange any work experience or shadow shifts, and then you could see what people are doing on the job and what you would need to get to that level. Right, so you need to identify the next steps in your own career pathway. What do you want to do next? Pick one or two. If you want, you could go 2 ways on that. But definitely pick one path that you want to go down. No one's going to hold you to it, but definitely pick one and see what you could do next and see what you could be aiming for. Preferably it's something that you are interested in yourself and would like to follow up on. For that, you need your next step. So it might be to finish this apprenticeship. So finish your level 2 in the certificate, finish your level 2 apprenticeship in healthcare support services. Complete your functional skills if you need to do it. So those will be your immediate next steps. And then you want broader ones after you have finished the level 2, because really it's asking what will you do after the level 2. So after that, what will you do next? Do you want to take the level 3 in healthcare support services? Do you want to take a full health and social care course? Do you need maybe to improve your business skills? Will it help you to take a management course? Do you need to take more qualifications in clinical skills? What will help you to get where you want to go? Do you need an access to higher education course to help you get it into a uni placement? Maybe if you wanted to go for nursing, what do you need to do? Right, and that's the end of part 2. Thank you for watching.